Welcome to today's virtual learning series on Friedreich's ataxia. We are glad to have you here to join us. My name is Sarah Fuchs, and I am a senior specialist with MDA's community education team. Today's learning event is a part of our larger MDA community education program, which focuses on bringing the neuromuscular disease community together around education and resources. Be sure to visit the Community Education section on mda.org for a complete list of our programs and educational materials. We are recording today's event and will be posting it to the website for on-demand viewing in just a few weeks. Everyone registered for today's session will receive a link to the recording via email once it is ready. Please know that all phone lines have been muted, but you can still ask questions. We'll have a Q&A session at the end of each speaker's presentation. Simply use the chat feature to type in your questions. Feel free to type in your questions as they come up, and they will be addressed at the end of the presentation. Please note that we may not be able to answer questions that are highly specific to your exact situation. We encourage you to contact your healthcare provider as they know your situation the best. Please also remember that we are here to share information and resources, not to debate. Please be kind and considerate in the comments. We would like to thank Biogen, the generous supporter of today's program. Their support helps make programs like these possible. MDA's mission is to help children and adults living with neuromuscular disease live longer, stronger, and more independence. Through targeted programs and innovative initiatives, we address the most pressing needs of our community. Today's virtual learning series will include 3 presentations. We will start with cardiac considerations in Friedreich's ataxia. This presentation will explain how Friedreich's ataxia affects the heart, explore current management and treatment options, and provide guidance for proactive, collaborative cardiac care. Our next presentation is on updates in research and care, and will review current trends and key findings in Friedreich's ataxia research, including emerging treatments and approaches and clinical trials. It will identify ways that individuals with FA and caregivers can stay informed and participate in ongoing research initiatives, and discuss the importance of multidisciplinary care and how new care models improve quality of life for people living with Friedreich's ataxia. Finally, we will cover understanding endocrine health in FA. This presentation will cover common endocrine complications associated with Friedreich's ataxia, including diabetes and hormonal imbalances. It will describe strategies for monitoring and managing endocrine health through nutrition, exercise, and medical interventions. And it will identify when to involve endocrinology specialists and integrate endocrine care into a broader treatment plan. After our presentations, we will hear from members of the FA community in our Community Voice panel. It is now my pleasure to introduce today's presenters. First, we will hear from Dr. Kamdar from the University of Minnesota Department of Medicine. Dr. Kamdar is an assistant professor of medicine in the cardiovascular division of the Department of Medicine at the University of Minnesota. She received her MD from the University of Minnesota Medical School. She completed her training in internal medicine and cardiovascular disease at the University of Minnesota through the Physician Scientist Training Pathway, in which she pursued a PhD in integrative biology and physiology. She completed her advanced heart failure, heart transplant, and medical circulatory support fellowship at the Cleveland Clinic. Her clinical and research interests focus on cardiomyopathy associated with neuromuscular disorders, such as muscular dystrophies, and clinical and translational research in mechanical circulatory support. I will hold off on introducing the rest of our speakers until it is their turn, but for now, Dr. Kamdar, thank you so much for joining us, and I will turn the time over to you.
Thank you very much, Sarah, for the kind introduction. It's really a pleasure to be here to talk with families and patients who are living with FA. I'm just going to share my slides. And so I'm an advanced heart failure and transplant physician, and I see many of the patients with FA in the neuromuscular cardiomyopathy program. I have an MDA grant, but no other disclosures. And then, over the next 30 minutes, really the goal is to talk about, why does cardiovascular care in FA matter? Why is it important? What are the different types of heart involvement that can occur in patients living with FA? What are the current guidelines for heart care? And then what are some of the treatments that are out there? And so, you know, Friedreich's ataxia is an inherited neuromuscular disorder that is autosomal recessive that occurs from mutations in the gene for frataxin or FXN. It leads to a deficiency of the frataxin protein. It affects about one out of 500 people born in the United States. It affects both men and women equally. And importantly, FA impacts the skeletal muscle, nerves, brain, and the heart. So neuromuscular disorders, including FA, have increasingly been identified to have cardiac involvement. And the cardiac involvement includes heart failure or cardiomyopathy, arrhythmias, and also problems with electrical conduction in the heart. And these cardiac involvements are very important to identify because they contribute significantly to how patients feel and survival in neuromuscular disorders. And on the right, there's a table that have muscular dystrophies and other neuromuscular disorders that have significant cardiac involvement. And today we'll be talking about the one in red, which is the Friedreich's ataxia. And so, Friedreich's ataxia is not only a skeletal muscle disease, but often a cardiac disease. More than 80% of patients living with Friedreich's ataxia will develop some sort of cardiac involvement. And this is, looking at the whole spectrum of neuromuscular disorders. The Friedreich's ataxia protein frataxin is actually located in the mitochondria, which is the powerhouse of the cell, and that's what we'll talk a little bit more about. So Friedreich's ataxia affects the mitochondria in the heart muscle. The heart and skeletal muscle and brain have a large number of these powerhouses of the cell that produce energy for these tissues, especially the heart. And in Friedreich's ataxia, there's a loss of the frataxin protein. And so it affects the mitochondria. It disrupts how the mitochondria work normally. And ultimately, it results in dysfunction of the mitochondria and decrease in the production of energy needed for the heart muscle cells. While we don't know completely how these changes result in the heart failure, these are some of the potential thoughts of how this occurs with the loss of the frataxin protein. And so heart muscle involvement in Friedreich's ataxia, this is a spectrum of how this kind of progresses over time. There's a normal heart with normal heart muscle function, normal size, and then the heart muscle there can be some scar tissue that forms in the heart. Ultimately, the heart muscle can become thickened with the loss of the frataxin protein in Friedreich's ataxia and become more stiff. And it can also develop another type of heart failure called dilated cardiomyopathy, where once the heart muscle instead of becoming thickened, it becomes weak and unable to pump efficiently. So this is kind of the spectrum of what can occur in the heart muscle itself. And so for hypertrophic cardiomyopathy and Friedreich's ataxia, we really identified this by echo. And then this is actually an autopsy sample, and you can see how thick the heart muscle is, where the cavity is very small. And this makes it more difficult for the heart muscle to pump effectively, especially because it's not able to relax. And what we also identified in the early stages is that there's heart muscle fibrosis. So this is actually from this patient, that there's a lot of abnormal heart muscle tissue and scar tissue. But now we don't need to wait until patients die. We actually can identify this much earlier, which has really changed how we can care for patients who are living with Friedreich's ataxia. And so cardiac MRI actually facilitates us to understand not only what the heart muscle function is, but also if there's scar tissue in the heart muscle. And so here's a picture of a little video clip of the heart muscle based on MRI from a patient who was living with FA. And you can see this is the left side of the heart and the right side of the heart. I know it's flipped. And you can see that this heart muscle is pumping normally and squeezing really well. And then we can look at the still picture and we're looking for all the heart muscle should be black. We're looking for any white areas in the heart muscle itself to suggest scar, and there's no scar tissue there. So how does this progress? So this is a patient who's living with Friedreich's ataxia. The heart muscle has become thickened, as you can see here. And then it's hard to see, but where this yellow arrow points, there's a bit more whitening of the heart muscle area. And that suggests that there's scar in the heart muscle tissue. And so scar tissue and a bit of the thickening are some of the first signs that can happen with heart involvement in the cardiac muscle with Friedreich's ataxia. And so, and this can progress. And so this is a patient living with FA with end-stage heart failure. And you can see here, compared to the previous MRI clips that we saw, this muscle is not pumping very well. It's quite big. You can see that the muscle is on the thinner side, but importantly, a lot of scar tissue has built up. As you can see here, a very small portion of the actual heart muscle is now black, which suggests healthy heart muscle, but a lot of it has become scar tissue. And so part of what can also occur in FA is that arrhythmias can also occur, partly because of the scar tissue, partly because of the way that the heart is functioning. And patients can have different types of arrhythmias. These can come from the top chambers of the heart or the bottom chambers of the heart, and it can also change how electricity is conducted throughout the heart that allows the heart to beat effectively. These symptoms for arrhythmias include palpitations, such as skip beats, feeling like you're missing a few beats, a racing heart, or feeling like you might pass out or actually passing out. And importantly, if you have Friedreich's ataxia and you're living with this, if you do pass out, it's a medical emergency that requires emergency care. So these look like chicken scratch, but these are some of the things as cardiologists that we're looking for on EKGs and on ambulatory telemetry or Holter monitors or Zio patch monitors, which you may have worn. And so, we're looking for normal rhythm, which looks like this. The atrial fibrillation comes from the top chambers of the heart. And then the ventricular fibrillation or ventricular tachycardia, which is the more scary type of heart rhythm, comes from the bottom chambers of the heart. And these can be caught on Holter monitors as well. And so there are guidelines for care for patients who are living with neuromuscular disorders, including Friedreich's ataxia. And so one of the biggest things is partnering with neurologists. So those neurologists who are seeing patients with Friedreich's ataxia, including Dr. Lynch and many others, are working together with cardiologists to see these patients. And then cardiac evaluation should be performed before patients have anesthesia or sedation. And then if there's any other types of surgery that are at risk for any cardiac involvement, anesthesia and cardiology should also be involved in the care of these patients. And so what are the guidelines overall? It's mostly important that patients who are living with FA receive proactive cardiac care. So this includes screening and diagnosis in the involvement of the heart muscle in Friedreich's ataxia. So at the time of diagnosis, having a complete cardiac evaluation with a cardiologist, and that should include, which we'll go through further, cardiac exam, ECG, some sort of cardiac imaging, and then there's regular follow-up annually or more frequently if necessary. And so one of the things that we did using the US Neuromuscular Registry, and this is specifically for Duchenne and Becker's, but we identified that a lot of the patients who have these disorders, neuromuscular disorders like Duchenne and Becker, and similarly like FA, who have a high risk of developing heart involvement, that very few patients were actually seeing cardiologists. So what we did at the University of Minnesota, when I was a cardiology fellow, is actually develop a clinic along with both adult and pediatric cardiologists, adult and pediatric neuromuscular neurologists, genetic counselors, and our pulmonary colleagues, as well as heart rhythm doctors. And then this is multidisciplinary, as I mentioned. We do cardiac screening in all of the neuromuscular disorders, including Friedreich's ataxia, and then also have an advanced heart failure program as well as a registry. And so, for our protocol, we see all of the patients with FA, both with the neuromuscular neurologist, so that reduces the barriers to care for these patients. And then if there are additional individuals that they need to see, that they also see them. And then this includes lab testing, cardiac imaging, ECGs, ambulatory telemetry, and then if they need additional care, that they're able to do this. And then we adjust how often patients are seen based on what they need ultimately. And so, what are the signs and symptoms to watch for, and when should you seek care if you're living with Friedreich's ataxia? So there's two types of, we talked about the heart muscle dysfunction and the conduction or arrhythmias, and some of these have overlaps. So it's more important as patients and families to look for the different types of signs that could suggest these. So if you have new or worsening shortness of breath, new swelling, for example, in your legs or abdomen, rapid weight gain, that means either 2 or 3 pounds in a day or about 5 pounds in a week, new skip beats, missed beats, more frequent skipped beats or missed beats, feeling like you're really dizzy, feeling like you're nearly going to pass out or faint, or, for example, not your ability to exercise or do your day-to-day activities starts to decrease where you feel more tired, that's where you should call your clinic soon to make sure that you can see a cardiologist, or if you have an established cardiology clinic, to make sure you can be seen soon. Where you need to go to the emergency room or seek emergency medical care is if you develop chest pressure that's persistent, that you have other symptoms with, if you faint or pass out, or have seizure-like episodes, if you have severe shortness of breath, either with rest or with minimal activity, you start to develop blue lips, confusion, difficulty being able to speak because you're so short of breath, or you develop a fast heart rate with symptoms like feeling like you might pass out, shortness of breath, or chest pain. These are really important to watch for to be able to get care. And so, what does the cardiac testing in patients who are living with Friedreich's ataxia look like? So this includes heart imaging, including can be an echocardiogram, which is an ultrasound of the heart. It can help us to understand if there's thickness, what the pumping function is of the heart, and then and so those are some of the important things that we can get from the echo. From the cardiac MRI, which you saw several images of earlier, we can actually get a detailed structure of the heart muscle, but we can also look at scarring and fibrosis. And so your heart specialist or cardiologist will recommend what they think is appropriate for your testing. And then for heart rhythm, we do an ECG or echocardiogram, electrocardiogram. This gives us a snapshot of your heart rhythm in that brief moment that you get the ECG. Tells us about the heart rhythm, the conduction, and if there's any other changes. So the reason that we use the Holter patch, the Holter monitor, or ambulatory telemetry is rather than just knowing what it looks like in that snapshot, we can actually look for abnormal heart rhythms or conduction issues between 24 hours to up to 2 weeks. So we can catch if you're having skip beats or missed beats or other types of arrhythmias without having to, you can go around your day-to-day activities and catch these. We often obtain labs. This may include cardiac enzymes, including troponin and N-terminal-proBNP, electrolytes, kidney function, and liver function tests as well. And so what are ways that, as patients living with FA or families, that you can support the heart? So it's important to stay physically active as safely possible. For example, working with physical and occupational therapy to come up with an individualized plan, focusing on heart healthy nutrition, such as limiting excess salt, avoiding dehydration, which can worsen dizziness and some of the arrhythmias. Unless you have a fluid restriction plan due to heart failure, And then making sure that you see the pulmonary medicine or sleep medicine team to treat sleep disordered breathing, which can put additional strain on the heart, and then having your whole medication list at each visit so that it can be reviewed by your team. And so, how can you best prepare for when you see your cardiologist or heart specialist? Is for those visits, track your symptoms. See if you're having any changes. Are you having more shortness of breath, new palpitations, skip beats, missed beats? What has improved? What's gotten worse? Bring questions into your team, such as what testing do you need? What is your heart function? Is there any scar in the heart muscle? And then work with your team to develop a plan for when you may need to seek emergency care. For other symptoms, who to call if you have symptoms, so you know how you can best treat your heart. And the interdisciplinary teams, especially through the Muscular Dystrophy Association care team, these are really important because patients who are living with Friedreich's ataxia have multiple systems involved, and the coordination of the care is really important so that your neuromuscular neurologist, cardiologist, everyone's aligned on your care, and also helps with communication, and then access to other therapies as well, and to be able to get treatment earlier, and that really helps overall. And so, talking about the medical management for Friedreich's ataxia, heart failure, cardiomyopathy, it's really dependent on what type it is. For example, if the heart is thickened, we use medications like beta blockers or calcium channel blockers to help allow better relaxation of the heart. If the heart is dilated, there are heart failure therapies that include this list here, that can actually help strengthen the heart muscle and improve the fluid retention as well, for example, with diuretics. And then I just wanted to briefly mention the Skyclarys. So Skyclarys is an FDA-approved medication for Friedreich's ataxia. It's really studied mainly to look at FA disease overall in terms of the neurologic function. It's not a replacement for standard heart medication treatments, for example, for cardiomyopathy or arrhythmias. And even on Skyclarys, those individuals who are living with Friedreich's ataxia still need routine cardiac follow-up and screening, as indicated. And then the monitoring on Skyclarys, this includes checking cardiac enzymes, which is the N-terminal proBNP, which is a heart stress marker, liver function tests, as well as lipids. And so these are important from a cardiac perspective for your heart health as well. And so talked a little bit about some of the heart failure medications. So these are the medications that we talked about, the class of 4 different types of medications. And while what it shows is that it helps improve survival. And so these are important medications to be considered with your heart failure cardiologist. And this is what we call our 4 pillars of heart failure therapy. And so, that's from the medical side of the heart muscle therapy and arrhythmia therapy, but there's also device therapy that includes if there's abnormal heart rhythms or conduction system delays, aspects such as pacemakers, ablations, or implantable defibrillators or ICDs may be recommended by your specialist. And if the ejection fraction remains below 35%, an implantable defibrillator may be recommended to reduce the risk of sudden death due to abnormal rhythms. And of course, this is on an as needed basis based on what your cardiologist or physicians see. So some of the challenges with the medical management for patients with Friedreich's ataxia is that patients who are living with FA were actually not included in the majority of our heart failure trials. There's also a spectrum of different types of heart failure or heart involvement that can occur in patients who are living with Friedreich's ataxia, and there have never really been trials specific to patients with Friedreich's ataxia and heart involvement. And so just briefly, rare aspects of heart care, including heart failure, includes transplantation. And so just briefly, this is rare in patients with FA, but this is some of the work that we're also doing to look at how patients with neuromuscular disorders, how they do with transplant. And this is some of the registry work that we've done, looking at patients with neuromuscular disorders have similar outcomes to patients with without neuromuscular disorders, again, in a highly selected group. And this is how the MDA is supporting this work, where we are looking at how patients who have neuromuscular disorders, what their outcomes are with transplant and ventricular assist devices. And that's work that will better inform, how we should proceed with this. And so the take-home message is that, cardiac involvement is common in patients who are living with Friedreich's ataxia. It includes cardiomyopathy and arrhythmias. Early cardiovascular screening is very important and indicated in all patients who are living with Friedreich's ataxia. And an ECG, cardiac imaging are some of the main things that are necessary in addition to the cardiac exam. Regular cardiology follow-up is necessary because now with the aspects like the MRI, we can actually detect changes much sooner and treat these appropriately. And then patients who are living with Friedreich's ataxia and have heart failure should be treated with appropriate heart failure therapy. And those patients who are experiencing arrhythmias or conduction system delays should be considered for appropriate care from an electrical standpoint. And then family members of affected patients should also be screened for FA. And so just wanted to acknowledge our group at the University of Minnesota, as well as our research groups and the funding for this, and wanted to thank all of you for your time. We look forward to taking your questions.
Thank you so much, Dr. Kamdar. If anyone would like to continue to submit questions, please feel free to do so in the webinar chat box. It looks like we did get one question, so I'll ask that, and if anything else comes in, we can address those then. So it looks like somebody asked, my blood work shows that I have no troponin release, causing the doctors to believe I had a heart attack. But when they did a heart catheter, it does not show signs of a heart attack. What else could cause the release of troponin?
So that's a great question. So we check troponin regularly in patients. You're right, troponin is a test that is used to identify heart attacks because troponin is a enzyme, or it's a protein that's inside the heart muscle. And so when there's damage to the heart muscle, for example, a major one like a heart attack, heart muscle releases troponin into the bloodstream. And for patients who are living with Friedreich's ataxia, we know that patients with FA and other neuromuscular disorders have ongoing minor heart damage because of weakening of the heart muscle cells. And so troponin can leak into the bloodstream for this reason as well. And it doesn't mean that there's necessarily a heart attack, but there's a large number of patients living with neuromuscular disorders that actually release troponin into the bloodstream. And so this is part of what, the routine testing that we do to look if there's troponin in the bloodstream, if it's increasing, and that's also helpful. So that could be another reason that with Friedreich's ataxia that it can be coming from the heart muscle itself, but not necessarily from a heart attack.
Wow, that's great information. Thank you for thoroughly answering that question. And I'm not sure if I misspoke because it looks like he did leave a comment that says he did have it in his blood work. So I just wanted to clarify that. I actually don't see any more questions in the chat, which probably means you were very thorough. So we appreciate all the information that you shared. Actually, it looks like maybe we got one more. I have two children with FA. They do not have cardiomyopathy. One has inverted T waves. Not sure if that affects his heart. Should he continue to see a cardiologist? He hasn't seen one in a couple of years.
So that's a great question. Thank you for asking that. I think it's really important from the perspective of, if there's any changes, for example, inverted T waves, to see a cardiologist just to get a baseline. I'm happy to hear that there's no other heart involvement, but I think that's an important aspect to follow up with a cardiologist and see, because over time things can change. And even sometimes just it's helpful to know that everything is going well.
Thank you. Yes, I think that's something that's really important is to learn that we learn from these webinars is to learn when to involve different specialties into care. Um, let's see here. I do have one more question. Which tests should I have regularly, and how often should these tests be repeated?
So that's a great question. So, for example, in the annual visits with your cardiologist, things that can be done easily in the office, including blood tests. The ECG can be done in office as well as wearing a Zeo patch monitor. So these are some of the tests that we do annually. The cardiac imaging, the current guidelines don't have specific time frames in terms of imaging. Typically, we've been doing annual imaging, and that's really dependent on where you're at and what your cardiologist recommends, whether that's an echocardiogram or if that's an MRI. And so those are the tests that we recommend on a regular basis to look for because we're looking for two different aspects, any heart muscle involvement with the cardiac imaging like the echo or MRI, and then with the ECG and the ambulatory telemetry monitoring, we're looking for any involvement of the electrical system. So those are the two things that at the visits that we're trying to identify because identifying these changes early are really important to be able to treat them appropriately, especially now that we have so many different medications that can treat and reduce the symptoms or progression of disease.
Absolutely, thank you. And then just a follow-up question, is there any testing or things that people could be monitoring at home?
So I think really following the symptoms is very important, like looking for shortness of breath or palpitations. Often people have, Apple Watches or other types of monitoring. So some of those are, ones that you could watch for. For example, while doing activities or doing exercises, if you notice that your heart rate's increasing a lot or you're having symptoms like shortness of breath, sometimes people catch that on their watches or notice that those changes are occurring. So those are the types of things that can be helpful. Um, I don't think like, for example, routine blood pressure monitoring or other things are necessarily needed, but those might be recommended by your specialist or cardiologist if that becomes necessary.
Great. Well, thank you so much. We really appreciate you coming on and sharing all this information with us.
Thank you so much. I really appreciate the opportunity.